So good evening, everyone. So this study is about the surgical outcomes of true muscle transplantation in large angle infantile esotropia. So as we know that large angle strabismus is often challenging and demands a series of surgery to achieve a satisfactory alignment, and the surgery involves multiple muscle and often necessitate to operate in the both eyes. True muscle transplant is a novel technique which basically involves transplantation of the resected stump of the tendon of lateral rectus and anastomosing it with the medial rectus. So what is the advantage by doing so? So the fact that the actual insertion of the muscle remains anterior to the functional equator, and yet the elongated length of the muscle results in good primary position alignment without any lateral incompetence. So this study reports the surgical outcomes of the TMT in large angle infantile esotropia, and it was a retrospective study which include all patients with infantile esotropia of more than 60 prism diopters, and was managed primarily as a TMT as a primary surgery. And those patients who had a minimal duration of follow-up less than 3 months and who underwent resurgery were excluded. So the primary outcomes we studied were the ocular alignment in primary gaze and its stability at 6 weeks and the last follow-up. And the secondary outcomes includes the lateral incompetence, the change in the palpebral fissure height, and the stereopsis. The correction factor, the total correction was calculated as a preoperative deviation divided, subtracted by the deviation at 6 months post-operative, and the magnitude of correction in prism diopters obtained per mm of transplantation was calculated as total correction subtracted by the correction due to the muscle recession and resection divided by the length of the transplanted segment. So the results, you can see here that the mean deviation change, the pre-operative deviation, which was 69.55, was reduced to about 3 prism diopters at the 6 weeks, and then it was stable at the final follow-up. And in the picture here, you can see that this kid has a 75 prism diopters of esotropia, the 2 weeks alignment, and then the final 1 year alignment. You can see the stability and the palpebral fissure height is not changed. So we did the motility analysis as well. So in here we can see that the abduction limitation, which was like post-operatively, in majority of the cases, it was just grade 1, and that too in the very large ET, like 95 prism diopters. And similarly, the palpebral fissure height, the pre and post operative, was statistically significant, and there was no limitation on the adduction, and the palpebral fissure height was also the same. So these are the surgical details of each individual cases, and the average correction ratio which we got was 2.94 prism diopters. And to summarize, the mean resection which we did for the lateral rectus was in the range of 9 to 12, and the medial rectus ranged from 5 to 6 and the total segment which was like transplanted ranged from 5.5 to 8 So there's a limited literature available in the long-term stability of the angle of deviation, and it was already reported by Jethani et al., and they have seen in the largest series of 22 cases of esotropia, and also the result correlates with the in terms of the success rate with Dr. Amitava et al. And there is a slight variation in the outcome, and that can be attributed to the difference in the patient selection, the surgical technique might be, and the etiology of the esotropia and follow-up duration. So the average correction per which we got was 2.94, whereas Amitava et al. Reported a correction factor of 3.9 prism diopters. So to conclude, true muscle transplantation emerges as a promising surgical alternative in managing the large angle infantile esotropia, and this technique offers significant advantage, including in terms of alignment, in terms of the incompetence, and preserving the palpebral fissure symmetry. And with further refinement and standardizing the surgical guidelines, we can use this as a potential the mainstay approach for the complex strabismus and the large angle correction, large angle strabismus. Thank you.
Just a small, I would just tell you. So Amitava sir actually had done for exotropia. And that is the reason he has got more than what we or you got, because all our patients and your patients are in esotropia,
Yeah.
whereas his patients were primary amblyopic patients.
Yeah.
And so probably the lateral rectus was tight, and so when they did surgery, they got better, rather more result than what we could get.
Thank you.